Ms. Dingell from Michigan for 5 minutes of questions.
Thank you, Mr. Chairman, and thank you to the witness for her attendance today. I'm concerned about this hearing. I quite frankly am here to learn. I share all my colleagues' concerns on both sides of the aisle about the impact of this pandemic on our children. I just do not believe we should be scapegoating unfairly one institution that represents we all support our teachers. And I think that there's very unfair scapegoating going on here. I regularly met with teachers throughout my district, both private schools and public schools, and to a person, while many of them were fearful about not infecting their kids, the teachers wanted to reopen the schools. And I want to remind this committee that Director Lewinsky was questioned regarding this topic at a March 2022 hearing before the Select Subcommittee under Mr. Clyburn. In a response to questions from then-ranking member Steve Scalise, Director Lewinsky noted that the CDC consulted with over 50 organizations prior to releasing the school reopening guidance, and that this ranged from parents groups to superintendents to boards of education as well as AFT. And my understanding is that responses received thus far from recipients of the chairman's March 28th letters confirm this assertion. Director Lewinsky also explained that the CDC allowed the groups more time than usual to offer feedback due to the importance of schools reopening safely. She noted that within months of the guidance being issued, the percent of schools that safely returned to in-person learning rose from 46 to 60%. And I'll remind my colleagues that in January 2021, roughly half of school districts were open. That's when President Biden took over. And by the end of May, over 95% of schools were offering in-person learning. So, and candidly, I don't personally think the input provided by AFT and that was adopted by the CDC was unreasonable. The first proposed edit sought to address an issue that the CDC's first draft did not mention at all, which was how to accommodate immunocompromised teachers when returning to in-person learning. My colleagues' accusations aside, I struggle to see how that was unreasonable. Our nation had entered a new phase in the recovery of the pandemic. We have now. Look around. We're in this committee room without masks, largely thanks to the efforts of the Biden administration. But remember where we were then. We have to keep in mind that it was January and February of 2021. The first vaccines had only been authorized for emergency use a few weeks prior. At this point, there was not enough vaccine supply to meet demand, and only 23 million doses had been administered in the United States. Meanwhile, the death toll was over 400,000. Under these conditions, to suggest that immunocompromised teachers might require some degree of workplace accommodation not only does not seem offensive, it seems compassionate and fair, as anyone who is immunocompromised with loved ones can attest. And the second edit that they proposed, I think, is a matter of common sense. They suggested that if a new variant were to emerge and cause high community transmission, Mr. Chairman, I know that there is a difference for you between school and community, but communities do impact what's happening in the schools, and if it was more deadly, that we would want to revisit our public health guidance. It didn't say close the schools again or keep the schools closed. So I don't think that that was unreasonable. And I'm also going to remind people that at the time, in late 2020 and early 21, schools had a lack of resources. I was on the phone every day finding masks and gloves and tests for my teachers. There was chronic underinvestment in schools and education. It resulted in overcrowded classrooms. There were windows that wouldn't open, poor ventilation systems that were incompatible with COVID safety measures, and the rollout of the vaccine was just beginning. So, and I'm going to remind you with Dr. Scott Gottlieb, who was the former commissioner of FDA under President Trump. Kids are less susceptible to the infection and less likely to transmit it but less susceptible doesn't mean they're not susceptible. And at that time, he agreed that the country needed to take measures to make sure that the coronavirus didn't become an epidemic in children. So can I ask one question, or am I out of time, Mr. Chair? So despite knowing the challenges teachers were facing and acknowledging the pandemic's health risks, especially in hot spots, Ms. Weingarten, were you ever given guidance by the Trump administration on how to safely return to in-person learning?
No. And that's part of the reason why we kept on pushing at it. And frankly, between the Rockefeller Foundation, Dr. Shaw, who I penned an op-ed with about the need for surveillance testing, that we could reopen schools with surveillance testing even before the vaccines, and with the work with the Cuomo administration and then Governor Cuomo, and actually work with Larry Hogan, then Governor Hogan. We were working with governors, we were working with superintendents, because no one at the Trump administration would work with us in terms of how to reopen schools safely.
Thank you, Mr. Chair. I'll yield back.